Ovulation kit. So, what is ovulation kit? How is it used? Why it is so important? Today we will be discussing all about it. Myself, Dr. Deepti Jain, gynecologist. So basically, ovulation kit is used to know exactly about the time of ovulation. Why it is so important to know about the time of ovulation? See, sperm has a half-life of about 3 to 7 days on an average of 5 days. While an egg after ovulation, it has a life of only just 24 hours. So it is very important that when ovulation occurs, the sperm should be available nearby so that the fertilization process can occur. That is why knowing the timing of ovulation is very important. There are not many methods by which we can know about the time of ovulation, like checking your basal body temperature, checking the cervical mucus thickness. We can go for follicular study. But out of these methods, ovulation kit is someone which is now being very commonly used, and it has definitely lot many advantages as well. It basically depends on the LH surge. See, in your body, when definitely in every cycle the hormones do change, and gradually the level of LH increases in a cycle. In a menstrual cycle, the level of LH increases after the periods. Gradually it increases, and just before ovulation, around 12 to 36 hours before ovulation, the level of LH reaches its peak, which we call as LH surge. So when the level of LH increases in your body, after 12 to 26 hours of that, ovulation usually occur. So basically these ovulation kits are based on LH surges. These actually test for your LH values. So how is this ovulation kit used? You have to take your urine sample. Ideally, it has to be taken between 10 a.m. to around 8 p.m. because at that time the level of LH rises. You should be fasting for at least 1 to 2 hours, as a result of which your urine sample will be concentrated. And in the kit, you have to put 3 drops in the well part given in the kit. There is a one control line and a one test line. So you have to see those lines. If there is only one single line against the control and there is no line against the test one, that means you are far away from your ovulation. When a pink line comes and one dark red line, that means you are reaching in few days your ovulation will occur. The LH has started increasing. The third condition, that means both the lines are dark, that means your ovulation is nearby. In around 12 to 36 hours you will be ovulated. So you should keep relationship in the next 12 to 36 hours so that the fertilization part can occur. So basically this is the mechanism of ovulation kit. So ovulation kits are basically very helpful. Now from which day we should start using the ovulation kit? See, you have to see for your period cycle. Supposedly it's of 30 days. Then you have to calculate the midpoint. The midpoint will be 15 days. You have to subtract 4 from it. So that comes out to be 11. So you have to start checking from the 11th day, right? Basically in every cycle you have to calculate the midpoint and you have to subtract 4 from it, and from that day you should start checking for the LH values. Basically from that day you should start doing your ovulation kit test. In ovulation kits usually a pack of 5 is available in the market, so definitely you should start doing from that day and repeat till the time you get 2 dark lines, right? Advantages of using ovulation kit is it's very handy, useful, convenient. But there are certain disadvantages as well. See, it checks for the LH surge, but it cannot assure you that the ovulation has occurred or not. It's going to check for the level of LH in the body. That means it will tell yes, LH values have increased. But because of that LH surge, ovulation has occurred or not, it won't be able to tell you, because ovulation, sometimes what happens, the LH increases but the follicle has grown but it doesn't come out. So luteinized unruptured follicle may result into it, and you may find a good result in ovulation kit, but actually ovulation has not occurred. This may occur. Right. Another condition like PCOD, in which there are multiple LH surges in the body. So again, the kit may fail. If your age is more than 40 and where the basal levels of LH is high, high, in those cases also the kits are not very useful. If you are on certain infertility treatment, then also these kits may give you false results. You are on certain antibiotics, then also they can also interfere in the results of these ovulation kits. So ovulation kit is definitely a very good method of checking for the ovulation, but we cannot 100% rely upon it. Definitely the method on which we can completely depend on, or the best method, is follicular study, that is to get an ultrasound done, and by which we can know exactly that when ovulation has occurred. Otherwise, other methods, as compared to other methods like checking for your basal body temperature or ovulatory pain, this is a comparatively more scientific and a better method. If you have any more confusions regarding ovulation kit, you can definitely write us down in the comment box section and can subscribe the channel. Thank you.